Hello, this is Stephanie Rojas with the University of New England, and today we're going to look at an explanatory visualization of some patient information that we have gathered on diabetic patients. So the first thing I want to talk about is kind of give you an overview of why we want to look at the data and how physicians are able to go in and treat patients with specific diabetic issues. So, of course, diabetes is a complex disease, and there are many health concerns that come into play for patients with diabetes, such as controlling their blood pressure, making sure that they get their eye exams and foot exams, and then how often we're monitoring their hemoglobin A1C, which will tell us their glycemic control and whether they're controlling their blood glucose. And lastly, look at their health of their kidneys and whether those have been impacted throughout this. So diabetic patients are also at a higher risk for coronary events such as heart attacks and strokes when overall health is not monitored and controlled. So it's really important to understand physician performance when it comes to that. So the goal is to have the patient visit their physician at least once a year, and sometimes they may go visit the physician a little more often if there are concerns with the test results. So here's the data that we looked at. A group of physicians within several practices who have met at least 25% of the target rate of the measures that we looked at. And some of those in 2016 and 2017 that we considered were blood pressure control, specifically patients who had blood pressures less than 140/90, because that's good control. Those that had an eye exam, a foot exam, and then those that also had their hemoglobin A1C less than 8, which again shows good glucose control. The nephropathy assessment is going to take a look at their kidneys and how healthy they are. So let's take a look at the data. So as you can see, we had several practices across the top and then across the bottom. For sake of this particular presentation, we didn't highlight the physicians, and also to kind of keep them anonymous here. But we showed you kind of the rate at which these physicians were measuring and documenting the patient's blood pressure control, eye exam, foot exam, hemoglobin A1C, and the nephropathy assessment. So for these physicians, you can see, like in the Cumberland practice, there were some physicians who did not capture that information and meet that 25% target, and then others who actually well exceeded that. And the same thing in the Knox practice. Each color represents those physicians, and we want to show you kind of how they compare to each other. Some of those kind of in the middle here had trouble kind of getting close to meeting that target, and then of course these basically weren't very good at meeting that target. So what we wanted to do is kind of give you a visualization of the care of diabetic patients and those measures that the physicians should be able to capture. And it's important to make sure that when your patients do come in to a physician's practice, or you as a patient, if you go see your doctor, you want to make sure that all of these things have been addressed, so that you can have good health and a long life. Thank you very much.